Cervical disc replacement. Let's talk about neck pain and degenerative disc disease of the cervical spine. Neck pain is one of the most common types of pain and one of the most common causes of pain-related disability. When the symptoms of neck pain, degenerative disc disease, and pinched nerves in the neck do not get better with physical therapy and anti-inflammatory medications, many patients realize that they need a surgical solution for their pain. For many years, the standard operation for this type of problem has been a cervical fusion. This operation works well for most people, but unfortunately, cervical fusions can accelerate the aging process in the disc above and below the fusion, which can lead to more pain, loss of range of motion, and need for further surgery. There is a better way. A cervical disc replacement can solve many of the problems that cause neck and arm pain, and still preserve normal range of motion of the neck. This is an MRI scan of the cervical spine. There are 7 vertebrae in the cervical spine, and we are going to label them C1 through C7. In between each of the vertebrae is an intervertebral disc. On this MRI scan, at the C5-6 level, there is a disc herniation. On this sagittal view, we can see how the disc is bulging out towards the spinal cord and the nerve roots. Now we are going to switch to a cross-section called the axial view. And here we can see how the disc bulge is putting pressure on the spinal cord and the nerve roots on both sides of the spine. The location of the pain is a clue as to which nerve root is being affected. The cervical nerve roots travel to particular parts of the arm and the hand. We have our patients complete a pain diagram and a pain journal, and this helps us confirm which nerve root is irritated and inflamed by the herniated disc. In the operating room, this is what we do. The surgeon makes a small incision, less than about 1 inch, in the front of the neck. With the help of an operating microscope, the damaged cervical disc is removed, and the fragments of the disc are lifted off of the irritated nerve root. This part of the operation is called a decompression. After the damaged disc has been removed, an artificial disc is inserted into the space between the vertebral bodies. An X-ray machine in the operating room is used to make sure that disc is inserted in the proper location, and the range of motion of the cervical spine is preserved. This operation has a terrific track record in the medical literature. The results of cervical disc replacement have been studied in more than 100 scientific publications. Patients with cervical disc replacements have better range of motion, less pain, and less need for further surgery than people who have had a fusion operation in the neck. After this procedure, patients can return to normal activities within 2 weeks. We advise patients to avoid sports such as mountain biking, horseback riding, and surfing for 6 weeks. But after everything has healed, we expect all of our patients to have normal range of motion of the neck and no activity restrictions. At the Minimus Institute in Monterey, California, we specialize in motion-preserving procedures for cervical disc disease. We want to see all of our patients free from pain and able to return to the activities that they love. If you are interested in a cervical disc replacement or alternatives to fusion surgery, contact our concierge and we will arrange to have your MRI scan reviewed by one of our surgeons.